So this is where now, like again, I'll try to just point out the main things. We're talking about the covering of axons. So all the axons in your brain are covered with essentially an insulation called myelin. So I brought up an old phone cord that I had in my office. So essentially, it's you have these axons that stretch all throughout your brain, and they connect the phone jack to the phone, so the inputs and the outputs. And this is where the electrical signals come coursing down. And so you need this insulation to keep those electrical signals within that axon. So in MS, it seems that that insulation gets chewed away. So I brought up this is my pathology of MS, this wire stripper. So essentially it just starts, see if this actually works. If it does on camera, I'll be amazed. It starts stripping away well, you get the idea. It starts stripping away. So there, I got a little piece off. Starts stripping away that insulation, and that insulation, once it's stripped away, those axons don't function as properly. So you can imagine if this insulation is now stripped away, you get a lot of static, right? So that's what's essentially happening in MS. You have relapse and remission, so your symptoms worsen, then they get better, then they worsen, then they get better, and this is one of the characteristics of the disease that I think is really kind of worthwhile to explore. So when you look at the brain, there are these lesions. So, and I'll show a picture of that, but essentially as the axon insulation is getting torn off, these pieces come floating off, and I know it's really small, but so they'll sit and you'll be able to image those within the brain, so you can see where there's part, damage. So what are the causes? So infections, pesticides, CNS immune responses. I think, those are, if we focus on those as the causes, and then we can maybe understand how some of these treatments are actually working. So you have these particular, infections that get into the brain that start to destroy the myelin sheath, and then, what do you do to actually propose treatments, or how do you treat those types of underlying pathology? So the symptoms, just, again, try to get this going through. Abnormal sensations, difficulty walking, dizziness, fatigue, muscle spasms, all these things that are, again, these axons are so important for, keeping things going. So any sensations that come into the brain, it can be in your arm, it can be in your legs, things that come in, you have axons that stretch all the way up to the top of the brain. And if those axons start to get destroyed, then there's static in the system, and those messages are not getting through. And it also, again, it depends on where those lesions are in the brain that will produce these particular symptoms. So this is just, again, an overview of the main symptoms, but since I already talked about those and I won't get into it, these are the different clinical subtypes. So I'll let you, if you have the slides, you can read that, but I think what I'm going to do is put up this one just to show the main sort of 4 clinical subtypes. So the most common is this relapsing remitting. So again, there's a disability scale on this side. So every once in a while the symptoms come out and then they go away, and then they come out and they go away. In this case, what it's showing is that it's actually progressing, so it's getting worse. There is another subtype, maybe I should put up the previous one. There is another subtype of the relapsing remitting where the disability, so again, increasing disability, you actually stay, when you're in the relapse, when you're in remission, your functioning is fine, you're not getting worse. So you have, you have all of a sudden you feel tired, feeling tired, and then it goes away, and then you feel tired and it goes away. So, and it's fine. But in the other case of relapse remitting, you can actually, feel fatigue, and then, but now you see your disability has actually gone up, and it's gone up again, it's gone up. So there's kind of a progressive increase in the disability. Which what you see here is these primary progressive versus secondary progressive. So you can see that the disease has a lot of these different clinical, pathways or clinical directions that either it becomes worse or it stays the same, but you have these recurrent attacks of the symptoms. And so again, this is, I think, something interesting for basic neuroscientists to figure out, well, why do these symptoms appear and then why do they go away? So there's a lot to be understood about how, again, if you look at the main underlying pathology of the insulation being ripped off the axons is that the brain is trying to repair itself. So it gets destroyed and then it repairs itself. As it's repairing itself, you can go into remission, but then the infection or whatever it is, the autoimmunity response is still there. So then it attacks more axons and you get, you go back into a relapse. So there's some interesting, the clinical patterns can often lead to understanding about what's happening in the brain. So these are just this is an MRI scan looking at some of the lesions. And it's, it often requires a trained eye to see where the lesions are, but at least this one points them out. So you have these really, these white particular types of lesions, and essentially that's scar tissue. So if you look at the microstructural level, so as we go down into the brain to look at what's actually happening. So here you have your nerve cell with the output, so the phone wire. So this will be the example of the day. So you have your healthy neuron with the phone wire coming out, and you have all this fat wrapped around, so the insulation to make sure the signals are getting through properly. In MS, what happens is that myelin starts to get destroyed, starts to get chewed away, so that here what they're showing is that signal from the input to the output, that signal slows down or it gets disrupted. So you get static in the system. And with that, as that myelin is getting destroyed, it doesn't just evaporate, it actually forms this scar tissue. So that's where those white sort of lesions are that you can see in an MRI image. So the scar tissue will still remain, and that can also then produce a secondary amount of damage. Can you hold your question till the end? Thanks. So again, I think this is the pathology that essentially defines what MS is that it's the myelin sheath around an axon that gets chewed up and then leaves scar tissue within the brain. So some people have argued that MS is essentially an autoimmune disease. So that now what's happening is, so the question now is, so you have this axon that's getting insulation ripped apart. So now why is it getting ripped apart? So what causes this, the wire stripper to get in there and start chewing up the axons? I should be able to do this. It's never good at whenever I ever have to strip a wire, I actually just use a lighter. I was never able to do that well. So what people think is that there's the immune response now. There's an immune response within the body that gets into the brain, and I think this is a really important part of this, that the immune system is typically not allowed into the brain. It's not allowed out of the blood system because of the blood-brain barrier. But in MS, it seems that the immune system has gained access to the brain, and there's a possibility that once the immune system, once those infectious particles, or not the infectious particles, but once the antibodies, let's say, or the microglia or whatever it's called, the antibodies, once they get into the brain, then they'll start chewing up the axon or the myelin sheath. So this is, so again, not to belabor on the issue about how MS comes about, but I think it is important to just, in the goal of reducing the amount of time that we spend on this, that the immune system does gain access to the brain, and when that happens, bad things can actually start to result. So if you have a macrophage, that's the one. So macrophages will enter the brain. Typically, simply put, macrophages are not supposed to get into the brain. The brain has its own macrophages, but there are ones in your body that do a really good job of mopping up infections and cleaning up, infectious particles. But once they get into the brain, what will happen is they can set off an inflammatory response. So we get back to, just like in a stroke, there's the inflammation that starts to happen. So what people are thinking is that it's these infection, or these particles that are meant to clear out of infections, which in fact are causing the destruction. So the macrophages are believed to be responsible for the demyelination, so the removal of that insulation around the axons. But at the same time, what they're doing is producing these other toxins, so cytotoxic factors, cytokines, And again, we get to these reactive oxygen species, so things that antioxidants are meant to take care of. So these macrophages set off all these other chemicals that can actually destroy the cells that produce the myelin in the brain. So there's two things that are happening. So in one case, so let's say this is our macrophage. So I'll call this this is the main cause. Let me just jump down to what the model looks like. So you have these microglia, these macrophages, whatever they are, these T cells, so things that are responsible for fighting off infections in your body are now, in fact, entering the brain. So these are not supposed to be in the brain. Again, there are chemicals, or there are these agents that do fight off infections in the brain, there's no doubt about that, but there's two sets. There's one set that stays in the body, another set that can actually get into the brain. It's the ones that are meant to stay in the body that seem to gain access to the brain that cause all the troubles. So this is your macrophage coming from the body, it's getting into the brain, and so now you have your normal axon over here, but in this case what those macrophages are doing is they're releasing these toxins, they're releasing these reactive oxygen species that are now destroying the myelin. I'm going to do it one of these times. Destroying the insulation on that axon. Oh yeah, I knew that was going to happen. See, that's why I don't try to strip wires. It doesn't break them. Oh, there we go. So there's a piece that's exposed now. So it exposes that inside, so the electrical signals now, they'll be static in the system. So that they can have a direct effect on the insulation, but there's also within the brain, here we'll use our trepanation tool here, there are also cells that are meant to make the myelin in the brain. So those cells will help, this thing right here, this oligodendrocyte, is actually making the insulation that goes around the myelin, or that goes around the axon. So in this case, the macrophages, these activated macrophages, are destroying these neurons that are supposed to myelinate the tissue. So it's sort of a double whammy. You have not only those toxins affecting directly on the insulation, the myelin, but those toxins can also damage these neurons that are meant to produce, to replace that damaged myelin. So there's two kind of underlying pathologies that are happening in MS. So obviously treatments would be to clear out those infectious agents or clear out those macrophages or replace those neurons that are meant to myelinate the axons. So this is one thing that I think is interesting, and again, I'm not a nutritionist, so I don't quite understand this whole thing, but it's some interesting observations that I've made that MS is more common in extreme northern and southern latitudes. So what some people say, that it's inadequate sunlight that impairs the ability for the body to synthesize vitamin D. So it's the vitamin D hypothesis. And so we'll get to this, because I just want to put this up, but this insufficient blood drainage from the brain. And I think this is actually, it really relates nicely to the whole infectious agent hypothesis, because as I said, if the blood-brain barrier is open, those macrophages, these guys that are not supposed to be in your brain, can actually get in. And they can get in because there's blood pressure built up in the veins. So if you release that blood pressure, then it can rebuild actually the blood-brain barrier. So our experts here can let me know if any of this is right, but we'll get there. So that's why I kind of want to, jump through some of this to get to that whole idea. So this is the world distribution of MS. So in red, you have high risk, and in purple, you have probable high risk. And then as you get closer to the equator, you actually have low risk and probable low risk. So you can see, at least as you go north, you can see that the risk for developing MS actually increases. So there's less sunlight, and the idea is that people are less able to synthesize vitamin D because of the decreased amounts of sunlight. And so what is the importance about vitamin D? There's obviously a lot of important things that are produced from vitamin D. It's important for the normal growth and development of bones. absorption of calcium from food, and its deposition in bone. So vitamin D is really important for our bone structure, which, that doesn't necessarily relate to the brain, but what's important, I think, in relation to the idea that these infectious agents are gaining access to the brain and then causing this demyelination or causing the insulation on the axons to be destroyed, is that vitamin D has these effects on the immune system. So again, I'm not an immunologist, I'm not an expert in this. The way that I look at this is that vitamin D is really important for helping the immune system work properly. And so if you don't have enough vitamin D, the immune system doesn't work properly, and it's possible that these macrophages that are in your body don't know where to go, and they actually go up into the brain. That's my kindergarten way of looking at it. So it does play a part in regulation of the immune system. So there probably is a contribution of a lack of vitamin D to the development of MS. And it's potentially through this effect on the immune system. And so there are some really interesting animal models of MS that I won't really get into in any detail whatsoever, but you can actually produce an animal model that is essentially MS, and when you give vitamin D supplements or UV light therapy, the actual progression of the disease is slowed down or almost halted in some cases. So there is some important factor, something important about vitamin D that when you give to, that there are links that it seems that low levels of vitamin D associated with high risk or probable risk of MS. And in animal models, when you give vitamin D supplements, you can actually stop the progression of MS. So there's another interesting aspect about vitamin D, and again, I can't go into the details because basically I just don't know the details all that well, but it does have protective effects. So useful in neurodegenerative and neuroimmune diseases typified by MS. So again, I think that all these things feeding together, suggesting that there is some infection gone awry in the brain that then starts to destroy the insulation around axons. There's something outside. So treatments. So again, these are the sort of the highlights that I wanted to point out today. So the stem cells, so going back to this idea about stem cells. So published online April 14th, so sorry, not 13th, but the 14th, so just this week, this study came out where, again, the idea is that you can put stem cells into the brain. So if you remember what I was saying is that, in MS you can have two things. You can have these macrophages destroying the actual insulation, or they can attack those cells that are meant, I'm not going to cut this obviously, they're attacking those cells that are meant to myelinate the axons. So it's a double whammy. So in the case of the stem cell therapy, the idea is to replace those cells that are meant to myelinate the axons, replace those with healthy ones. So as those are dying, you put stem cells in, and those cells come back. But the interesting thing about this study is that these researchers took mouse and rat skin cells, put them into the brain to replace those cells that myelinate the axons. So basically those cells that are destroyed in MS. And so what they did is they were able to coax these skin cells into those what are called the oligodendrocytes. I'm just going to put it out there now. So the oligodendrocytes are the cells that wrap nerve fibers of the brain and spinal cord in myelin, so with that insulation. So you can get those, so those cells are being destroyed in MS. So the idea is turn those skin cells into those oligodendrocytes, get them into the brain, and replace that myelin, which seems to be working, at least in rats and mice. So yeah, so adding myelin back by transplanting young, immature oligodendrocytes into the patient. So that's the idea, is that these cells that myelinate axons are being destroyed, so you just replace them. And then the idea is that once those functioning oligodendrocytes are put back, they'll recoat that lost insulation, which it seems to be what they found. So they were able to convert these mouse or rat skin cells into these oligodendrocyte cells, oligodendrocytes, by essentially messing with the genes. So it's probably one of these things that they had some idea which genes were responsible for forming these particular types of cells. They didn't know exactly which ones, so they just sort of, started testing one after the other, and they were finally able to find, I think they said they found 7 genes that they could turn a skin cell into this oligodendrocyte, stick it into the brain, and then it was able to actually create this protective myelin sheath. So it was able to replace that lost myelin, that lost insulation that they had in their animal model of MS. So again, I think, so the question when we were talking about stem cells is not only to be able to get them to do the particular, to differentiate into a particular cell, but then once they get into the brain to do their particular function. And it seems that at least in a rat and a mouse, they've been able to do that, and using skin cells. So not even worrying about fetal tissue or anything like that. So you eliminate all of the ethical issues, not totally, but at least reduce the ethical issues. Okay, so now let's get to this other, so there's where you have this idea that you can, at least in MS, if you notice that those oligodendrocytes are dying, you can replace those with stem cells, and they'll rewrap the axons, they'll produce the myelin. So the other thing though is that this insufficient blood drainage from the brain, so the cerebrospinal venous chronic cerebrospinal venous insufficiency, this liberation therapy that was developed by, or maybe it wasn't developed, there was probably some other steps leading up to this, but really kind of popularized by Zamboni and his liberation therapy. So as I said, the idea is that there's, let me just see if I in fact have this up there. So the observation, at least by Zamboni, was that there were these deficits in cerebral venous outflow in MS patients. So essentially, the veins are responsible for allowing the blood from the brain to go back to the heart. And what he was noticing is that there were twists or blockages or tears or whatever it was in the veins that are draining blood from the brain. So the blood was getting plugged up, it wasn't draining properly. And so the idea then is that this creates some pressure in the blood vessels, and with that pressure, the blood-brain barrier can be opened up or it can get damaged, and now infectious agents from your bloodstream that usually don't cross the blood-brain barrier can get into the brain and produce all those toxins that will destroy the insulation of the axons. So this was something that, that I read. So it's abnormal cerebral venous reflux. It's peculiar to MS. So he didn't see it in Parkinson's, Alzheimer's, or ALS. So other neurodegenerative disorders that have, it's particular ALS that has a motor component to it. So what is the theory? So I think the one, actually I'm just going to put all this up here so I can keep going through this. But so I've sort of already talked about this. Zamboni was talking about a lot of iron into the brain, which again, I think there's a bit more controversy over the idea that there's a buildup of iron in the brain that will start to destroy axons. From my point of view, I think it flows much better to when you start to think about the infectious agents getting into the brain, slipping through the blood-brain barrier. What's actually happening is you have this narrowing or stenosis of the cerebral veins, causing a reflex and building up pressure in the brain, so in the blood vessels themselves. This pressure opens up gaps in the vein walls or breaks the blood-brain barrier. So then these macrophages, these infection-fighting agents can actually get in, cause these toxins to be released, cause this inflammation, and destroy the myelin sheath. So I don't think I'm going to get too much into this, but again, essentially what's happening is the veins are important for bringing blood out of the brain back to the heart. That's the simplest way to talk about it. So what's happening in what Zamboni actually was talking about is that there's improper blood drainage from the brain in MS. So you can see here that normally these are the blood veins that are coming out. So what he shows here is that there's a bit of essentially a twist. And if you blow up that image, you can see that, normally this blood vessel should look like this. And in this case, it's twisted so that there's less blood coming out. So this would be, the normal blood flow, nice and dark and black. Whereas in the case of a blockage or whatever, a twist, whatever it was, there's less blood flow coming back. So you'd have pressure building up within the brain. And so from his paper, he had a bunch of different examples. And I had a video from CTV, but I'm not going to go to that. But anyway, so the idea is that you have these twisted or blocked blood veins that are supposedly draining the brain of blood. When you don't drain that brain, there's buildup of pressure up here. The blood-brain barrier starts to give way. Macrophages get in, and they start to cause, let's say, inflammation. And that's what will then destroy myelin. So I think I might jump over this. So this is what Zamboni reported, is that all of his MS patients showed stenosis in the venography. So again, this could have been a selection bias. It's hard for me to imagine that it would be a selection bias unless he had some pre-screening, but apparently, his patients all had some sort of blockage in the drain of the veins that drain the brain. So we want to talk about that. So again, what that happens is you have significant pressure difference across the stenosis. So the blood from the brain is not draining back to the heart. You're building up pressure up here. The blood-brain barrier gets broken down. Macrophages get in, and they start to release toxins into the brain that then destroy myelin. Yeah, that's a bit much more detail than we need. So conclusion, let's just jump to the, so essentially I should probably talk about the results, is that when he did open up their veins, their symptoms actually went away. So it was almost like they were cured. Although again, it's one of these things that the symptoms may have gone away, but it's possible that the pathology is actually still there, but at least it gives the brain a chance to go into that sort of that remission phase and repair itself and not have that continued buildup of macrophages entering the brain. So there is a strong link between the cerebral vein insufficiency and MS. It does, I don't know if I necessarily agree that it's the causing factor. It is probably a factor in MS. So again, as that blood pressure builds up, the blood-brain barrier breaks and these macrophages get in and they start to wreak havoc. And this is something I skipped over, but the pattern in the different blockages, or the types of blockages, actually, what Zamboni noted is that they do determine the clinical progression of MS. And I think this is, I think this is a really safe conclusion, is that patients be screened with ultrasound at first signs of MS, because you want to catch this before it gets worse. So again, you can have this pressure buildup, and if it goes undetected for long periods of time, you're going to get a lot of these macrophages in. They're going to release a lot of their toxins, and the damage will start to be produced. But if you can stop it at the first signs, then there'll likely be less damage, and the brain will actually sort of repair itself. Okay, so I want to leave it there because it's 12:20. So maybe my experts can say if I said anything wrong.
We just wanted to talk about the valves, because it's actually the vein valves that on most people, there is sometimes a twisting in the vein.
Yeah.
But usually it's at the valve, and it can either be like a leaflet, or it can be that the valves, you actually are born, you see, with this.
Okay.
And you could have the valves pointing the wrong way.
So I'll just say that loudly, is that it's not always a twist in the vein. There could be a valve issue that it's, in fact, so valves for the veins should be opening this way to let the blood drop down from the brain, fact, they might be flipped and not opening the proper way, so you can't, you know, the pressure will build up there. And that could be a genetic contribution. But you two have had the surgery.
Yes.
And so what's the outcome of, I mean, night and day?
I've had very good,
Yeah. So the symptoms before surgery were like some of those that are put up here, or? I don't want to put you on the spot if I'm.
It's probably easier to say what it helped with, because
Okay.
there's so many things.
Yeah.
It helped with my gait,
Okay.
my walking, my
Right.
normal, and it helped with my balance. And initially, it didn't help with the length of time I could walk, but that was corrected later. It helped with headaches incredibly, and trigeminal neuralgia, which is
Right.
very common in MS, went away completely. And another benefit I had that has stayed and was a total surprise was my vision improved.
Okay. So yeah, so there is a big
Fatigue.
symptom recovery for sure. And it's long term?
Almost 3 years now.